So I had a subscriber ask me, how do you do CPR while somebody's in a stair chair? Can you do CPR while going down the stairs in a person with cardiac arrest? I'll teach you how to master this technique. Stay tuned to this video. I got you. So, I have no idea how many cardiac arrest victims I've been able to help. And I actually have no idea how many of them were on stairs, but it's definitely a lot of them. So imagine having a cardiac arrest. This is the one train. Having a cardiac arrest at the top of the train, all the way up on New York City public transit in the middle of the winter, carrying all these bags. So we had the stair chair, response bag, oxygen bag, and the cardiac monitor. And if you find someone in cardiac arrest, there's no elevator there. You would have to bring this person down to the ground floor while maintaining high quality CPR with minimal interruption. So if you ask me, how do you do that? What do you do and how do you do it? First and foremost, you take the stair chair, hoping that this person is just a regular call, because you can't get the stretcher up there. But if it happens to be a cardiac arrest, then you or your partner have to go down to the ambulance and get the long board and make sure that the long board has 3 straps, because you cannot provide high quality CPR while bringing the person down on a long board, let alone a stair chair. So what ends up happening is you're here with the patient, then here's the landing before you take the other stairs. What you're supposed to do is, depending on how long it took you to get down this landing, because if you did high quality ventilations and compressions right here, and then it took you 15 seconds to get down here, you might as well go all the way down and have the stretcher waiting for you down here. But if for some reason it took a while, then you gotta pause here, do another cycle of CPR, and then go back down the stairs. So in the 911 setting, we use the book, and that's the AHA book, as a reference, but sometimes we have to adapt to the current scenario. So if the scene is unsafe or something's going on, you're not gonna go and try to transport this patient on this stair chair and put him back down similar. So look, you're not gonna, like this picture right here has like a automatic compression machine, and this has never ever happened in my 20 years of experience in front of me. Has it happened? Maybe. But for some reason, what you see here is that they got the person on a stair chair with a compression machine, but is there really a good flow of blood in this patient? No, because his legs are bent. So the blood is supposed to go from the legs to the heart. But if we have these obstacles, they're not going to be receiving oxygenated blood or good perfusion. That's why when you transport these patients, you're supposed to transport them like this, which is on either a scoop stretcher, a long board, or something similar to it. And if you can see, he has an auto pose or something that provides compression. And all these guys are really doing is carry him down. It's for training purposes, but what I would prefer to have on this patient is the person intubated with somebody in the back giving rescue breaths. I would prefer having the monitor not on the person's arm, but on the person's legs. And I don't see no strap on the patient's legs down here either. So it's for training purposes. I had to block the people's face out so I won't get sued or anything like that. But basically, at the end of the day, if you want to figure out how are you going to be able to provide high quality CPR to a patient going down the stairs, because it'll happen, you'll be in the projects, the elevator's not working, this person's in cardiac arrest, you just got a pulse back, now you got to transport them to the nearest hospital, and they're freaking 300, 400 pounds. What ends up happening is you go down these stairs and then rest right here. You rest right here, do another cycle, then go down the other stairs and do it just like that. But the good thing is you're new. On a cardiac arrest, in the majority of cases, you will have a supervisor from the fire department there. someone with more experience, or your partner will have more experience, and they will guide you through the process. So once again, doing CPR on a stair chair is something that I've never witnessed. But for some reason, it's depicted here. Whatever. This is the way we do it in New York City. You have buildings 10, 20 floors up into the sky. Sometimes the elevators don't work, or they're too narrow for the stretcher, for all the equipment and all the people. And one thing I want to mention is that besides using the stairs in those cases, notice your grip has to be used. Your body will be exerted. You don't want to be fragile. You don't want to be weak. You want to be strong physically and mentally, because in scenarios like this, where you're carrying somebody down the stairs, another human being, in narrow spaces, you are liable to injure yourself. That's why in my previous videos, I always said, and I always continue to say, make sure to be resilient. Make sure to watch what you eat. Make sure to stay healthy. I know it's easier said than done, and the drive-through is a lot easier, but you want to stay ready so you don't have to get ready. Because when shit hits the fan, similar to what you're seeing here, you don't want to be the person going to the hospital for a broken foot or something along those lines. Trust me, I've seen it one too many times, and it's totally avoidable in the majority of cases by just leading a healthy lifestyle. So to answer your question, how do you provide CPR, or how do you transport a patient in cardiac arrest to the ambulance? And it's this way, not this way. All right, my people. And another thing I want to tell you, I've noticed that I receive a lot of questions as to how do I do this, how do I do that, and please keep them coming. I will help you. I will make videos to answer them. But if you want to have these questions answered on a weekly basis, I'm going to be providing a free newsletter to everyone in this YouTube channel, all the subscribers. I'm calling us as a community the Advocacy Alliance. So advocacy is basically being an advocate for your patient. That's why it's committed responders and patient advocates. The Advocacy Alliance. I want us to build a community from like-minded responders, people who care about their reputation, who care about their patients and want to do the best for them. And for that reason, I created a newsletter where in the link below, you'll be able to share your information, and I will personally be emailing you a weekly newsletter to help you on your road to becoming a better EMT. So you're going to be having the YouTube channel that's going to be having constant uploads, and plus you got 500 plus videos, the other videos that you can watch as well. And you're going to have the weekly newsletter, and you'll see there's also a special surprise at the end of the form for those that want to have live access to me. So once again, my people, I hope this helps. If you have any other questions, any other suggestions, or anything you want help with, just let me know. I got you. Peace.